So yeah, so Pelabresib is a BET inhibitor, BRD4 inhibitor, certainly an active inhibitor of NF-kappa B, which we've learned is in addition to the JAK-STAT pathway is very important. So we know that if we have to add on to what we do with JAK inhibitors, maybe blocking a separate inflammatory pathway is the way to do that. And maybe it gives us different outcomes, right? So maybe we can improve upon what we already do, maybe do something better. And so in the phase 2 MANIFEST study, Pelabresib was studied in multiple different cohorts, right? It was studied as a single agent, post-ruxolitinib. It was studied as an add-on to ruxolitinib in suboptimal responders. It was studied in the treatment-naive setting in combination with ruxolitinib. And overall, there was exciting stuff that came out of each of those cohorts, activity across the board. Most exciting was probably in the upfront setting where we saw response rates in terms of spleen and symptom responses we'd yet to see with single-agent JAK inhibition. And so that's led into the MANIFEST-2 study where this is being looked at in combination in treatment-naive patients in comparison to ruxolitinib as a single agent. I mean, ultimately, you can say whatever you want about phase 2 studies, right? We get very excited about those, but we don't know if something's truly better, right? Historical controls are historical controls. We don't know if something's truly better until we compare it head-to-head in a blinded fashion to take some of that excitement and that inherent bias out of things and really compare something to the standard of care. And so really that's where the MANIFEST-2 study is going. And it's very exciting because I think what we're trying to see is can we do better than we've done before, right? Yes, in terms of spleen and symptom responses, but also in terms of disease modification and disease biology. Right? And I think that's where correlatives are going to be very interesting. Are we able to see changes in the bone marrow, changes in mutation status, longer and more durable responses? And I think it'll be very exciting to see what comes of that study.